The United States Agency for International Development, USAID, has contributed immensely to HIV prevention, treatment, care of persons living with HIV and AIDS in Nigeria, and orphans and vulnerable children affected by HIV. As at 2014, when the Lopin 1 project started, Nigeria had HIV prevalence of 3.4% and estimated orphans and vulnerable children OVC burden of over 17.5 million, including 2.3 million children made vulnerable by HIV and AIDS. With support from USAID, other donors, and government of Nigeria, the recently conducted Nigeria HIV and AIDS Indicator Impact Survey, NAIIS 2018 report, has changed the narrative with national HIV prevalence of 1.4%. The Association for Reproductive and Family Health, Arfh, an indigenous non-governmental organization with experience spanning close to 3 decades on public health programming and interventions, was one of the 3 indigenous NGOs that implemented the Local Partners for Orphans and Vulnerable Children project in Nigeria, Region 1, Arfh Lopin 1.
The Lopin 1 project, essentially, that is being implemented by Arfh, seeks to mitigate the impact of HIV/AIDS among vulnerable children and households through a multi-pronged approach based on the identified needs of the children themselves and the caregivers.
Nutrition, please clap for her.
The Local Partners for Orphans and Vulnerable Children in Nigeria, Lopin, had a 5-year cooperative agreement between Association for Reproductive and Family Health, Arfh, and the United States Agency for International Development, USAID, that ran from 2014 to 2019. Arfh implemented the Lopin Region 1 project in partnership with the relevant line ministries in 3 states, Akwa Ibom, Lagos, and Rivers State, across 23 local government areas in collaboration with 17 community-based organizations, CBO, to mitigate the impact of HIV and AIDS on children and their households. The project implementation was in line with the 3 project objectives, which sought to achieve improved systems and structures at community, local government area, and state in providing responsive care, protection, and support services to orphans and vulnerable children and their households. In addition to enhanced organizational and technical capacity of local Nigerian partners to offer services to orphans and vulnerable children and their families, and facilitation of local Nigerian CBO partners to engage more effectively with local government areas and private sector partners.
We prioritize the services that are provided to children based on their age group and their needs. We ensure continuum of care from the community to the facility, and then facility back to the community, so that children can continue to benefit from services. We refer and link children to existing facilities by the government. So when we started the project, we started with advocacy to all the states and local governments we are working in. Then we also had technical meetings with all the partners that are there, so that they know exactly what we are bringing in, what their roles will be, the expectations of the project. Then we engage community-based organizations who engage the community volunteers. Then we do capacity assessment of CBOs, of the local governments and the state, to see what their capacity is with regards to delivery of services for OVC.
To forestall ambiguities on the eligibility of beneficiaries, USAID Nigeria provided guidance on 5 enrollment streams, namely children of adults currently on antiretroviral therapy, ART, children of adults tested HIV positive, HIV-exposed infants, high-risk adolescents such as out-of-school youth in poor households, exploited and abused children, children of female sex workers, key populations including children and adolescents living with HIV.
The Lopin project is unique because it's employing total continuum of care, such that to address the maternal, newborn and child health integration into this program, pregnant women are assisted to attend antenatal clinics regularly and supported to deliver in health facilities. Again, mothers are encouraged to practice exclusive breastfeeding and assisted to ensure that children complete immunization against childhood diseases. Caregivers of undernourished children are provided with food, support, and supplements, while severe cases are referred to health facilities.
Arfh, with support from USAID, enrolled and enhanced the well-being of 210,751 orphans and vulnerable children and 53,337 caregivers drawn from 53,117 vulnerable households. Every enrollee received a spectrum of services in line with their care plan, ranging from health, education, child protection, psychosocial support, food and nutrition, and household economic strengthening to HIV prevention, care, and support.
Do you want to get pregnant and drop out of school? So most of it is you looking at where you want to go, and then you set the things that you need, where you need to be at a particular time to get there.
These social protection services, targeted to improving the livelihoods of vulnerable households, are to ease recovery from economic tremors, improve economic resilience, smoothen household consumption, and mitigate the impact of HIV and AIDS. The Arfh Lopin 1 project provided enabling environment for increased uptake of health services such as HIV testing, antenatal clinic, prevention of mother-to-child transmission, antiretroviral therapy, viral load monitoring, immunization, and treatment of minor ailments. The Arfh Lopin 1 case managers conducted HIV risk assessments, index testing, genealogy testing for partners and children of index clients, and sexual partners in collaboration with HIV testers, trained by treatment partners for the screening of eligible persons.
When I was pregnant, I didn't have care. Then they now come and meet me, have people come and meet me. They now took me to hospital. Then they come and do me tests. After doing tests, they tell me I'm not well with my begin. They now give us medicine to come and take. Then have people come and give us 10,000 to take and buy food for my baby and myself also.
Thereafter, the newly diagnosed persons living with HIV, PLHIV, were provided with incentivized enrollment support to cover the cost of card fees, basic tests, food and logistics support for 2 subsequent drug refills, in addition to adherence counseling and monitoring for viral load suppression at appropriate intervals. The Lopin 1 project also conducted activities in line with UNAIDS 95-95-95 target that aims to end the AIDS epidemic by 2020.
The UNESCO goal 95-95 seeks to achieve very unique mandates, starting on the grounds that 95% of persons living with HIV know their status. And of this 95% that know their status, 95% is linked to treatment to assess antiretroviral therapy. And of these 95% that are on treatment, 95 of that also are adhering to treatment. That is the essence of the UNESCO goal of 95-95-95. So that only a minute percentage of 5% could fall through the cracks, but 95% should know their status. Of these 95 are on treatment, 95 are adhering on ART. This is a global mandate that has been placed and then set for achievement. For us in Arfh Lopin 1 projects, we have adopted a number of strategies to ensure that we meet this goal.
Towards the achievement of the UNAIDS 95-95-95 goal, 192,622 enrollees now know their HIV status, 83,200 in Akwa Ibom, 55,979 in Lagos State, and 53,443 in Rivers. Also, 9,560 beneficiaries are HIV positive, OVC 4,726, and caregivers 4,834. Linkage to treatment, retention, and adherence to regime has improved tremendously, with a cumulative HIV positive profile of 7,176, consisting of 2,662 children living with HIV, CLHIV, and 4,524 persons living with HIV, PLHIV. A total of 139,802 children received the required health support services with improved treatment outcome.
We're in collaboration with Index Client Tracking Team of treatment partners
in the communities to follow up for genealogy testing when index cases are identified in the community. We also work in partnership with private health service providers to ensure that there are no missed opportunities. So our testing has been scaled up to how to reach areas like the creeks, coastal areas. Some of the strategies we have employed in the creeks for case finding include sunrise testing, that is early testing, to ensure that pediatrics and adolescents are tested before they set out for their fishing activities because it's the creek. And then the moonlight testing, when they return from their various businesses, we're able to meet people at home starting from 5 o'clock to about 7 p.m. And it has yielded results.
In further response to the call for the elimination of user fees, Arfh Lopin One Project pioneered the pilot implementation of Community-Based Health Insurance Scheme, CBHIS, across the 3 project states, Akwa Ibom, Lagos, and Rivers. With support from USAID, a total of 2,154 beneficiaries are currently accessing free health services through the elimination of user fees. The rehabilitation of adolescent and youth-friendly and competent centers, such as located at General Hospital Ikot Ekpene, Akwa Ibom State by Arfh.
Touch yourself and be happy. Or yeah, clap for yourselves. So life in general.
Who made the center more conducive for adolescents and youth through the provision of a modern table tennis court with accessories for recreational activities, giant plasma television for training and viewing of educational materials, indoor games, infrastructural development, and blazing the trail as the first youth-friendly center in the state with free Wi-Fi services for browsing and other internet activities. Provided facilities for enhanced site management by FHI 360 and Arfh, who enrolled the CLHIV/ALHIV and provided differentiated services to them with support from USAID. The center is also a very conducive safe space for adolescents and youth who no longer have to queue at ART clinics with adults for drug refills with the attendant stigma, which affected uptake of HIV services. Furthermore, the Arfh Lopin One Project provided sets of pediatric weighing balance, bowl and standing, to ESM facilities and CAR teams to facilitate timely commencement of treatment for newly diagnosed CLHIV.
I was raped 2015 on my way coming back from school. After the community testing group tested and I found out I was positive, that was when Arfh Lopin One came in and took me to the hospital where another test was carried out, and I was enrolled in a facility where I go get drugs. They have helped me in my nutritious value range to be taking my drugs. My viral low value has suppressed to 121. I can do more better than that if I continue to take my drugs until I achieve my you to you. I'm very grateful to USAID for providing this help to Arfh.
To improve teaching and learning environment and exempt enrolled vulnerable children from direct payment of fees, levies, and other charges, Arfh block grant interventions were implemented in 8 schools made up of 6 primary schools and 2 secondary schools with 2 streams each, JSS and SSS. This facilitated the seamless progression of the girl child from primary to secondary school level. The out-of-school adolescent girls were re-enrolled back to school as part of our Second Chance education support. A total of 135,562 children, 72,990 in Akwa Ibom, 21,955 in Lagos, and 40,617 in Rivers, received education support and were mentioned for school attendance, retention, performance, and progression to new classes/course completion.
It's moral upbringing of a child that determines his output in future.
Before the coming of these furnitures, we always have broken chairs and we were not able to concentrate in classes because we are only observant on where we are going to sit down. But after the coming of these furnitures and these chairs, it makes our class look more attractive and students are able to sit down very well to learn, and learning is very effective. I sincerely appreciate and commend the USAID for their efforts in these furnitures and also to make it a learning environment conducive.
The block grants intervention, model of intervention, has also had a very high impact. This block grant model of intervention provides what the school needs in order to be able to train these children properly without the children providing those things themselves.
We have another group of children for who one reason or the other cannot attend the formal schooling sector. Arfh facilitated access to vocational skills acquisition and preparatory to livelihood engagements for those who were interested.
I have seen
that our children now live a better life through the advice gotten from this project, and some have been given vocational training.
They were enrolled in sewing/fashion design, hairdressing, confectionaries, barbing, textile publishing, etc., including beneficiaries of our second chance interventions and provided with business startup materials and equipment. A total of 445 adolescent girls and young women, AGYW, and 85 adolescent boys have benefited from this scheme as they have been trained to acquire vocational skills. These interventions have significantly averted or mitigated teen pregnancies, transactional sex, child trafficking, substance abuse, and other related societal vices. The Child Protection Committee, CPC, worked in concert with the Community Quality Improvement Team, CQIT, to promote child safeguarding practices, positive gender norms for desired attitudinal changes, and prevention of gender-based violence, which is one of the drivers of HIV transmission in Nigeria.
The project has impacted a lot on the lives of orphans and vulnerable children in Lagos State and their members of their households. In Lagos State, a lot of schools have also been upgraded through the project, and then the project has also improved the economic status of the families of orphans and vulnerable children in Lagos State. Before the project in Lagos State, a lot of OVC, they don't have access to birth registration. But with the project now, we have a lot of orphans and vulnerable children that have been able to get their birth being registered with the National Population Commission. And then also in Lagos State, there are a lot of children that are infected and they are able to go to school, but through the project, they are now back to school.
Similarly, to protect the identity and inheritance rights of vulnerable children, a total of 164,110 children who previously did not have birth certificates were registered and issued with birth certificates in partnership with the National Population Commission.
My children were also given birth certificates, and I was also given community-based health insurance scheme card, which I used to access free medical services and attain antenatal for free.
I want to act like a boy now. My dear, how are you?
Okay.
What's the problem? You know I like you now.
To mainstream positive gender norms into school curricula, a total of 120 senior primary and secondary school teachers were trained and equipped with the guidelines of 12 modules to facilitate the training of adolescents in schools. The intervention provided deepened understanding of gender norms, adolescent reproductive health, HIV prevention, treatment, and care, with progressive reduction in gender-based violence and risky behavior amongst adolescents.
I believe you have heard one or two things about gender, right?
Yes!
Who can define gender for me? Gender. The meaning of gender. Yes, Bosu?
Gender means a characteristic that's associated with both male and female.
Very good. Clap for her. With the help of Arfh Lopin project, I have trained 140 pupils on gender norms. It has enlightened me, myself, then has enhanced the ability, to take other pupils or other students in this line to expose them to things they need to know about gender.
Well, actually, we do take a lot of topics, like we can talk about health, we talk about HIV, we talk about knowledge is life, we talk about gender.
And we've learned about self-esteem. You should be confident of yourself.
The economic strengthening component was structured to build and consolidate the economic resilience of caregivers to meet the basic needs of their children in a sustainable manner. A portfolio of interventions was implemented, including market survey for thriving businesses and skills in project localities, vocational skills acquisitions, financial literacy trainings, livelihood supports, and provision of business startup materials.
We have also built the capacity of the household themselves, to be able to take care of their children in terms of provision of household economic strengthening methods, in terms of conditional cash transfer, in terms of CBHIS, in terms of provision of startup business materials, trainings in financial literacy and business management.
This represents a paradigm shift from tokenism to sustainability, which increased engagement of government, the private sector, and community stakeholders. The trickle-down effect of these interventions are manifested in the increased school enrollment, retention and progression, food sufficiency and security, and improved health-seeking behaviors, especially in the uptake of HIV services and adherence to ART, thereby contributing towards the realization of UNAIDS 95-95-95 goal.
From this communal business, I've been able to boast and many other of our members because we could take care of our family, they could go to good schools, and the rest of them. So it has been a great help to us.
We are into a communal business, which we call Ifedapo Enterprise. This business was founded by Arfh Lopin One Project, and we are into palm oil business. We started this business in 2018 with 29 gallons of palm oil, but now we've been able to get much more profit. To get 32 gallons, we've been able to get lots of benefits. But before we commenced the business, we were given a financial literacy training organized by Smoothen. During the process of this training, we were being taught on how to document the goods sold out, how to save our money, how to keep the records of the available goods, the goods we bought and the remaining ones. This has really helped us a lot. This led to another opportunity in another organization that supported us with ground and machine, and we thought of taking from the money contributed into our social funds of VSLA Group to be able to establish another shop. While some of our members were privileged to benefit from it, and they are doing excellently well now. Every one of us is benefiting from the association.
A total of 11,504 caregivers received household economic strengthening HES support, while 1,093 adolescents were provided with economic empowerment materials and equipment for economic generating activities.
I now have money to buy drugs and access health facility. My children now have good school uniform and clothes.
The cost of HES materials per individual range from 30,000 naira to 60,000 naira. Also, 655 adult villages and saving loans associations, VSLA, were inaugurated and 165 share-outs conducted with accumulative accrued savings and interest of 151,640,314 naira, approximately $420,056.
$1,006,000.
In addition, 49 adolescent VSLA were inaugurated with savings of 1,344,360 naira, approximately $3,734. Arfh pioneered the implementation of VSLA Plus with the integration of routine medical checks of vital signs, blood pressure, blood sugar, rapid diagnostic malaria tests, etc., and distribution of insecticide-treated nets to pregnant women and mothers of children under 5 for the prevention of malaria. In line with the PEPFAR guideline for OVC programming, Arfh Lopin One Project implemented conditional cash transfers, CCT, for the most vulnerable households to meet their consumption needs and increase access of their children to education and health services, while linking caregivers to VSLA in the community for financial literacy and participation. The sum of 30,000 naira business startup supports as part of HES was provided to each beneficiary in 3 equal installments of 10,000 naira per tranche, and beneficiaries were enrolled on the community-based health insurance scheme. A total of 1,567 caregivers were provided with conditional cash transfers linked to VSLA, enrolled on community-based health insurance schemes, and supported with HES to meet the needs of their children sustainably. The Akwa Ibom State Agricultural Development Program, aka DEP, ACADEP, supported the Arfh Lopin One project with 200 bundles of cassava stems, which were distributed to caregivers engaged in cassava farming. For improved value chain during harvest, 45 caregivers were trained on cassava processing and marketing. Arfh Lopin 1 project strengthened the community-based organization's capacity to increase nutrition awareness and conduct nutrition assessments, counseling and support and integrated nutrition interventions into its early childhood development activities, and strengthen nutrition referrals and linkages for a total of 130,802 OVC. Arfh conducted baseline capacity assessment to ascertain areas of strengths, weaknesses, opportunities, and strengths, which informed targeted interventions to fill identified gaps and build technical and organizational capacity of government and community-based organizations.
We have also strengthened the capacity of the staff.
For improved performance, the system's skills were enhanced and new knowledge and programming for orphans and vulnerable children were developed for focal staff of the community-based organizations.
The supervision of the sub-recipients, CBOs, or our branch offices. There is the routine visit, to these areas or these organizations. Then we also ensure that when we are disbursing funds, to the CBO or sub-recipients, it is according to the MOU, because we have to sign MOU with them, and the MOU will state clearly, exactly, how the terms and conditions of the contract will be implemented. So we use this one, and then when we are disbursing funds to them, we also know exactly what do they have still in the bank, and then what are we sending to them, to complete the implementation.
At the start of the project, we empowered the CBOs on the use of norms and on the use of data. Because if you collect data and it's not used, you can't appreciate the value of that data.
The government staff were trained on project management sustainability, monitoring and evaluation, service provision, gender norms within the context of HIV and AIDS. Community-based organizations were equipped with NOMIS software and desktops to facilitate data capturing, collation, reporting, and use of data for planning and decision-making.
We walked through community-based organizations in all of the local governments where we worked. When they came on board, we did initial assessment of their capabilities and capacity. We trained them on financial management and reporting format, and over time, I think they have keyed into it.
Lopin 1 met us the point whereby we are doing what we feel like doing. But the first OCAT assessment, a lot of gaps were identified. That gives opportunity to rather have an organization to be trained by Arfh Lopin 1.
All this while, they were building us to be global organization. They followed due process and standard. And today, I beat my chest and said, thank you, Lopin 1, because we can compete globally.
And we have been given a lot of equipment. We have a generator that were given to us, we have computers, we have QuickBooks, which is one of the accounting packages that is of very much essence while actually implementing an intervention.
The CBO have now seen themselves as an integral part of the national response to OVC and were determined to consolidate on the achievements of Lopin and promote ownership.
And for everything that we do, we try to take the states and local governments along, because we know that at the end of the project, we need to hand over these children to the states and local government. We don't want to leave them without any supervision, without any support.
So the idea is to ensure that there is ownership of these projects across the communities through the establishment of community structures that would outlive donor funding. And Lopin as a project has done remarkably well in ensuring that these community structures are established across the communities that would outlive the lifespan of the project.
Arfh partnered with us, and so the sustainability will continue seamlessly.
Arfh Lopin 1 project has executed 21 memoranda of understanding with states, ministries, departments and agencies, and local government to independently coordinate and manage orphans and vulnerable children activities in their jurisdictions.
Arfh has been responsible and a responsive organization reputed for quality service, and they have done so, providing these services to orphans and vulnerable children Arfh Lopin 1 has supported the institutionalization of an adolescent-friendly center, which has led to an increase of uptake of adolescents in HIV/AIDS program. They have also been able to implement household economic strengthening interventions, including conditional cash transfers that have contributed immensely towards improved economic resilience for our vulnerable households in some of these communities.
The secret of our success is largely due to the visionary leadership of the two founders, complemented by highly dedicated workforce that reflect the core values of Arfh in terms of professionalism, transparency and accountability, integrity, and we treasure high quality services to our clients. And I think the fifth core value, which is very important, is prudency and efficiency in the management of financial, material, and human resources.
Indeed, a cursory appraisal of the project shows a streak of success stories in meeting identified needs of vulnerable children and their caregivers through multi-layered interventions and strengthening at the community, local, and state government levels for effective coordination of orphans and vulnerable children activities and child protection by caregivers and gatekeepers.
Yes.
The Arfh Lopin 1 project has successfully been implemented and finished innovatively with sustainable positive impact on beneficiaries. We are grateful to USAID and will welcome another opportunity to consolidate on the laudable achievements of USAID on Lopin 1 project in Nigeria.